Welcome back, viewers. This is Chungu cha Jamii. Today we are talking about cervical cancer awareness. Given that this is the Cervical Cancer Awareness Month, on the show we have Dr. Alexander, who is helping us to understand issues concerning cervical cancer. He's told us about issues of the cervical cancer, that they are transmitted, that one who has recurrent issues of STDs are the ones at risk, and those that are sexually active are prone to get the virus if you're not visiting your doctor and getting to know about your health. We'll continue with our doctor. So doctor, before we went on a break, you're telling us about the risk factors and the issues concerning the STDs.
Yes.
Given that a lot of us are not aware, and you've given us the symptoms that one should look out for.
Yes.
And also emphasizing that once the patient is treated, we should also look out for the partner. Why is it important, and why is it important for me to bring my partner in this? And should the partner be afraid? Because in most cases, if it is a lady who is getting this ailment and these issues of STDs and also UTI, because I've had cases of one being treated UTI and then you're coming back with the same issue. And also now that you've mentioned STD, you're treated, then you come back again with the same issue. Why is it important to come with him, and why should it be that the partner should accompany you and not be afraid of coming into the checkup with me?
Okay. So as I said, it's very important because this means that you're taking responsibility or collective responsibility as a whole. So remember, as we said, we actually said that HPV is a sexually transmitted cancer. So that means that it takes two. So as much as we could be treating now, because as a gynecologist, majority of my patients are females, but you will find that most of the time it's contributory. There's a male contribution, or to the disease process, there was a male contribution. So we need to tackle that part. Otherwise, treatment will not be whole. So it's always important to, when they come, we explain to them the consequences, and we explain to them that this is why we need you here. You need to take some medication, and that will help, because when you take the medication, you're going to also help your partner in that regard. So that's why we advocate for that. And then you see now, when we're also talking about that, we always say that even as we treat the STI, we always propagate, you need, after treatment, you need to come back with your partner and like encourage your partner to get to get screened for at least cervical cancer, because there are various modalities. There isn't only one. Yes.
Now that you've mentioned about me coming in with my partner and also empowering the boy child about the same.
Yes.
Does that mean that, can I put it this way, forgive me or correct me if I'm wrong, that it is, the root cause is from the male species?
I would like to say that. I won't. Okay, that's a very, how do I put it? It's a very controversial statement. But all I will just say is that HPV can be picked anywhere. We cannot say that it definitely came from the male or came from the female. The whole point is that let us stop the propagation of the HPV virus. That is the whole message that I want to get. That's the message I want to get out there. Because it doesn't matter who has it. The whole point is that if you've transmitted it, once it gets to someone who is susceptible, then that means their chances of developing cervical cancer are higher.
You've said that the HPV virus can be collected from different places.
Yes.
So other than one collecting it from the partner, where else can one get it from?
Now, of course, we have seen it, like especially for people who use intimate, like clothing or intimate things like towels, or even like for those who use intimate items, shavings, like with shavers, it can be picked from there. But then again, when you look at the statistics, they are quite negligible in terms of transmission. Most of it is sexually, and because just when you think about it, for it to reach the cervix, that's what contributes more.
Oh, okay.
Yeah.
So cervical cancer as an ailment,
Yes.
is it a death sentence for one person?
So I always say that there's nothing like even now, because remember even the onset of HIV, everyone was like, you get HIV, that's a death sentence. But now, in this day and age, it shouldn't be, and it is not. Because we always say that what we advise is that please just get, like, early screening means to better prognosis. Of course, if you get it later, that means that you will not be able to, that means that the chances of you having a successful recovery are a bit lower. And maybe now that means that we may have to do things like palliative care or things which, if we had intervened earlier, would have had a better prognosis. Yes.
Given said that,
Yes.
Once I've been diagnosed with it at
Yes.
an early stage,
Yes.
does that mean that it is curable? And at what level do you say it's not curable, if at all it is?
Yes, as we actually say that if you get it early, and that, because you see now, when we look at cervical cancer, there's something called the pre-invasive, meaning that it is just developing, but it's not invaded past the cervix. That is actually the best time to get it, because there are various modalities that can be done, from things that we call cryotherapy, thermoablation, LEEP, which means that a bit of it is cut using a machine, and you actually are able to shave off the infected part, and you find that we have our women surviving, and even when you follow them up to now, there's no evidence of a recurrence or a relapse of cancer. But of course, as now it becomes more invasive, it moves now out of the cancer, moving down into the vagina, or moving across into the ovaries, or moving up into the uterus. That means now that it becomes more difficult, and now it means that even treatment has to be more aggressive, like from surgical options, or now chemotherapy, or actually radiotherapy, because now we do actually something called chemoradiotherapy. Then from there, we also have to see if it's now spread to the lungs, or if it's spread to the brain. That means that now the chances of a successful cure are low. Yeah.
Now that you've mentioned chemoradiotherapy,
Yes.
what is chemoradiotherapy and what's the difference when you say radiotherapy and chemotherapy? Now that you've combined the two,
Yes.
why do you combine, and what is the difference between the two?
So basically, chemoradiotherapy or chemoradio means that you are using, both of them complement each other, because in essence before we used to do individual, so maybe you would say this patient just does radiotherapy, or this patient does chemotherapy. But we realized that as studies were done, that when you combine the two, one sensitizes, like now, because I don't go into so much, but it potentiates the other, so that when you use them together, you find that the outcomes in treating the cancer tend to be better. But this is for patients who have now invasive. Now, when it has really spread, now those are the ones that you make a choice and say, this is a patient who would benefit more from that sort of treatment. Yeah.
Because now you're using the two, so it says it. Do we have stages like we have maybe in breast cancer?
Yes.
Stage 1, 2, 3,
Yes.
and 4? Even in
cervical cancer we do. Yes. So the staging basically, like there's stage 1, 2, 3, and 4. 1 just basically means it's limited to the cervix. 2 means it's gone into the cervix, but it's still limited in that area down, like it's still limited, like now it's gone spread. I don't want to be so detailed, but let me just say that there's a bit of spread towards the pelvic side wall. 3 means it's hit the pelvic side wall, and now it's can actually block the passage of urine going out. 4 means that now it's gone to other organs. So, and this applies for basically every cancer. When we say it's stage 4, it means it's gone out from the organ of origin, and it's gone to other organs. So this means in this case, it's gone to the rectum, it's gone to the bladder, it's gone to the bone, it's gone to the lungs, it could go to the brain, it's gone to the intestines. So that's what we mean.
Oh.
Yes.
Okay. Now again to that question, maybe
Yes.
we can recap on it. We've said the chemotherapy and the radiotherapy. What is chemo exactly? What is the process of chemo, and what is the process of radio?
So chemotherapy is basically where you just use medical agents which are able to target actively producing cells. And to make it simplified, because it's very complex, because there are various chemotherapy agents that act at various aspects of the dividing cell. But in a nutshell, this medication is able to target a cancerous cell, and destroy it. That is chemotherapy. Now, radiotherapy is where you're using now beams, and let me just use for people to understand. It's like you're using X-ray or other forms of energy to target a bunch of cancerous cells so that you destroy them. Now that's what radiotherapy is. So that you see, even when you do radiotherapy, it has to be targeted, because the problem is with radiotherapy, you can injure also the cells which are normal. So you want to do minimal injury, but maximal targeting to the affected place, yes, or cells.
Given that,
Yes.
we have a lot of the side effects when it comes to when you're maybe in stage 4 of cancer, and the effects of going to chemotherapy. You'll find those people who are maybe vomiting, who are not able to eat, who are losing a lot of weight. Is this because of the medication that they are on higher concentration that is making them to be affected? And after using these ones, and what are the effects in now the patient's body?
Of course, now that is both. So the effect, now those side effects can be both from the disease process. They can also be both from the curative process. So as I told you, this can also affect cells which are just, of course, the innocent bystander cells. So at the end of the day, when you give chemotherapy, these patients are usually given other agents to prevent the vomiting, because it can give a lot of itching. It can also discolor your nails. It can also it can cause some bleeding. So you're also given a lot of other agents to prevent those nasty side effects. Then also when you when you look at it, the disease process itself can also cause that, because when it's affecting and it's gone and affected the kidneys, it's affect where you have kidney failure. And remember that cancer is itself, it's a metabolically active process. That's why you find these patients it uses a lot of energy, glucose, to produce cancerous cells. So that's why you find that these patients are constantly complaining of night sweats. They're constantly fatigued. It can go infect your bone marrow, so it means that your cell line production is low. You're having these things we call anemia. Constantly you're tired. You are also having your immune system dropping, because chemotherapy itself can also reduce the immune system, the function, the potency of the immune system. So you can actually be at risk of getting recurrent infections. Just simple infections like a cold me and you can get can bring someone down who's on treatment.
Oh.
Yes.
Nice. Okay. We've mentioned about one who is diagnosed with it at an early stage having to recover.
Yes.
And mostly not having an issue of relapse or maybe reoccurring of the cells. What makes one not to reoccur? And for those who reoccur, what makes them to reoccur?
So you're basically, now we are talking about relapse, or we are talking about what we call relapsing or getting the cancer back. So again, it will depend on so many factors. Did they complete treatment? How aggressive? Because again, yes, there are some cancers, you can get cervical cancer, but again, when you look at cancer, there are different sorts of grading of cancers, some which are better than others. So if you get something which is you can get actually maybe a cancer that's not spread so much, but it's a very high grade, meaning it's, even if you look at the way it's spreading very quickly, as compared to someone who may get a very advanced cancer, like you get them at stage 4, but they have a low grade cancer, so it's taking longer to advance. So it depends on all of that. Again, it will also depend on things like your immune status. It will depend on other things like, are you HIV positive or having any condition which is lowering your immunity. All of those play a part, even genetics. Like, if you're genetically predisposed, that means that possibly compared to now another patient who's receiving the same treatment, you may find out that your outcome is, or rather you are relapsing more as compared to someone who has a better genetic predisposition.
Given that you've given us the information of genetics, we're going to take a short break, but after the break, I'd like us to tackle on, when you say genetic, does that mean if I'm from a lineage of people who have cancer, am I also prone to have the same cancer simply because it is in our genes? But we'll get to that after the break. Viewers, I hope you're learning as much as I am about cervical cancer and how to treat it, how to take care of it. We are being told, or we have learned that it is transmitted. You can be diagnosed it at an early stage, and if it is not as active and it is not spreading so fast, you can get cured and not get the relapse of the same. We'll take a break and we'll come back with more information about cervical cancer. Continue sending in your comments, your question across all our social media networks. That's GBS TV Africa. Our SMS line is 21144. We'll be back shortly.